My name is Suzanne Lentzsch. I'm a professor of medicine at Columbia University in New York, and I presented data on linvoseltamab in patients with relapsed refractory multiple myeloma. I reported an updated analysis of the LINKER-MM1 study. It was a 14-month follow-up. So in principle, bispecific antibodies have been shown very effective, and the BCMA-CD3 bispecific antibodies have response rate that range between 61 and 63%. So here I presented data of the LINKER-MM study in which patients received 200 milligrams of linvoseltamab, a BCMA-CD3 bispecific antibody. And patients received 200 milligrams of the bispecific antibody weekly until week 14. Between week 14 and 24, the schedule was biweekly. And if patients had a VGPR, that schedule could be reduced to a monthly treatment. That means it was very convenient for the patients to receive just a monthly injection. So in terms of the baseline characteristics of the patients, our patient population was a little bit older, so the median age was 70 years. And also there was a patient population that was over 75, around 26% of those patients were older. Also, there was a significant number of patients who had high-risk multiple myeloma, such as the ISS stage 3, that was around 18%. Also, extramedullary plasmacytoma and high-risk cytogenetics occurred in a significantly amount of number of patients. Around 40% had high risk and around 16% had extramedullary plasmacytoma. So in terms of the response, the overall response rate was high with 71%, and looking for patients at a VGPR that was 63%. We could also see that among the patients who achieved a CR, there was a high rate of MRD negativity. Patients with a CR and eligible for MRD assessment had 93% MRD negativity. So that means if the patients responded, their responses were usually very, very deep. What about subgroup analysis? We are always interested in the older patient population and also high-risk patient populations, and we could see that there were high benefits, especially in patients who are usually difficult to treat, such as patients over 75, high-risk cytogenetics, but also extramedullary multiple myeloma. We also saw that the responses were achieved pretty fast. So a PR was achieved in median after 1 month of treatment, VGPR 2.6 months of treatment, so very fast response rates. And when we looked for the progression-free survival, that was not reached at the time of the presentation for all patients, but also not reached, of course, for the patients who went into CR. Looking for the overall survival, that was also not reached for patients who had a complete remission at the time of the presentation. Looking for the overall response rate of all patients, that was 31.4 months. When we did an overall survival analysis at 12 months, the probability of survival at 12 months was 75% for all patients, and 100% for patients with a CR. So in terms of emergent adverse events, of course, one of the biggest concerns is always the cytokine release syndrome that occurred in any grade, around 46% of the patients, but mostly were really grade 1 and grade 2. And I think only 10% of the patients even had grade 2, and there were no grade 4 events. Another issue that's associated with bispecific antibodies is also the occurrence of infection. We could see that 75% of the patients had an infection, and we also observed that around 36 of those patients had a higher grade infection, grade 3 and 4. So patients needed appropriate prophylaxis for the infection. But what we also observed that was very interesting, that over the time, if we look for patients who were treated for 1 year and longer, the grade 3-4 infection rate decreased significantly to 6%. So that was a very positive result, that probably with response to the multiple myeloma, but also with really adhering to a very strict prophylactic regimen, the infection rate after 1 year was only 6%, grade 3 and 4. So altogether, I think this is another bispecific antibody that has shown to be very potent with 70% response rate. It's very convenient to give, especially if patients who achieved a CR with a monthly treatment. And what we observed was that the infection rate decreased with the time of treatment and was relatively well handled with appropriate prophylaxis.